I tore my ACL and meniscus 10 weeks ago. Now I have surgery in a week. This is how I'm preparing to give myself a strong starting point for after surgery. The more muscle you have and the larger range of motion you have before surgery makes rehab after surgery so much easier. So this is what I've been doing. I'm going to go over all the exercises I've been doing, my progressions from week 1 to now week 10. I'm going to go over my range of motion from week 1 to now week 10, how I've increased my range of motion over this time, and any tips and tricks I have for you guys. I'm also going to cover really briefly diet, because diet plays a role in recovery and the healing process for your body. So I'm going to go over that today in this video. So in the early on phase, weeks 1 to 3, I was doing 4 types of exercises. So I was doing wall sits, 5 reps of 10 seconds. The deeper my squat was, the more pain I had in my knee. This was a little difficult at first, but I kept doing these for a couple weeks. My second exercise was leg raises, so doing 2 to 3 sets of 10 to 15 reps. This was great to kind of get my quad activating. This was difficult early on. I did have a bit of a quad lag issue, so just that connection between the muscle and your brain. So your brain's telling the muscle to fire, but it was just lagging, and this was a little bit difficult at first. The third one was single leg balances, so balancing on the affected leg for 30 seconds at a time and 3 reps of those. And I was also going on daily walks, so I was going for walks about 1 to 3 miles at a time daily, and this just helped kind of get my leg moving. My gait was affected during this time, so I'm not sure if that's really recommended to do at the time, but that was something that I was doing early on. And with that said, depending on if you know what kind of graft you're going to have for your ACL surgery, you could work with a physical therapist to kind of tailor your exercises to target those muscles, because you want those muscles as strong as possible before surgery. That way you have a higher starting point and you get back through rehab quicker. And now weeks 3 through 10, I did change up my exercising routine just slightly. Once I had the MRI results back and I had some bone fractures there, I basically was told to go non-weight bearing, use crutches. I did that for about a week, and then I kind of started progressing back to walking. I didn't have any significant pain, so I thought it was okay on my own. But during that time, I was still avoiding weight bearing exercises, so no more squatting, leg balances, anything like that. So during this time, my main exercises were leg raises. I'll do 3 sets of 20 at least every time. I'd also do heel slides, so 3 sets of 20 for those. I'd also do banded leg extensions, 3 sets of 20. And then I'll do light walking around week 8. I was feeling pretty normal. I didn't have any issues with my gait or any knee pain. So walking around that time was pretty easy. And now the frequency for these sets of exercises, I would do these at least 3 times a day. If I could work them into my daily work routine, if I had a few moments to spare, I'd do maybe some leg extensions in my office chair. At least 3 times a day, I'd do those exercises. All right, guys, so just woke up today. I want to take you through a quick little prehab routine that I do every morning. So just come in here straight thing in the morning. Haven't stretched or anything like that, so I'm probably pretty stiff. I'm going to show you guys how my leg is looking now at about 10 weeks after ACL tear. So as you can see, I can get pretty straight pretty quick now, first thing in the morning. It's not fully straight compared to my other leg, but it's pretty close. So just within like maybe a minute here, I can probably get it just to fully straight on its own, just sitting here. Propping my leg up by my ankle here could kind of accelerate that. But then some of the exercises I do every day, so just some leg raises. Just come in here. I like to do it a little bit slow. Just get some nice full range. And I'll do about 3 sets of 20 of that. My other exercise, usually I'll use like a band. I don't have one around here right now, but just some heel slides. So just come here like this. Really try to get as far, bend my leg as far as I can, essentially. Just come in here. Do 3 sets of 20 of this. Right now, I don't know if it's my meniscus or what, but something's like popping kind of like deep in my knee, it feels like. And it feels like a tiny little pop, like, I don't know, like a bubble. It's kind of weird. Just not comfortable feeling. It's not too painful, just unsettling, I guess. I don't know. But so yeah, that one, a little difficult with my meniscus tear, I think. Hopefully after surgery that gets fixed. And then last but not least, some leg extensions. So I usually use a band here. I'll have a band from the chair leg around my ankle. Watch out, Moose. Come here. Moose, watch out. And I'll just straighten my leg like this. Right now it's still popping kind of in there. Oh, it feels a little weird. Watch out, Moose. So that's kind of my routine every day. I used to at least do those 3 exercises. Yeah, there's still that weird popping kind of on the lateral side where that complex meniscus tear is. I don't know if that's what's also preventing me from being able to hyperextend my leg all the way past straight. Because normally I can kind of hyperextend here. So you see my other leg, that's kind of a weird feet pick, but all right. This might show a little better. So this is as far as I can go right now with my injured leg. And with my good leg, I can hyperextend it, as you can see, a decent bit further there. So yeah, that's my quick little routine every day. 3 sets of those, 3 times a day. I usually throw on extra exercises like walking, hip abductors, glutes, abs, but that's the 3 mandatory exercises I have every day, along with that knee extension stretch, just kind of get that full extension there and work on that. That's going to be really critical after surgery from what I've heard from all my physical therapists and doctors. So yeah, quick add in here. So I just started cycling again. This is about 6 days out from the surgery. I'm going to keep doing this every day, get some leg strength back, and get as strong as possible for surgery. For range of motion, my main focus was getting leg extension fully back, so going fully straight. My legs can typically hyperextend, negative 10 degrees. At week 10, I still can only get to 0 degrees on my own. I can hang past 0, but on my own, I cannot get that hyperextension back currently, but that might be due to my meniscus tears. I'm not sure, so we'll see after surgery if that improves. But you want to make sure you get leg extension fully back, that way you can activate your quad and start doing exercises properly and get that strength back before your surgery. After surgery, regaining leg extension is critical because scar tissue could form, which will then prevent your leg from extending fully over time, and that's something that you can't actually get back. You have to have surgery to remove that scar tissue if that's something that happens. So before and after surgery, it's vital to get that leg extension back. So in order to gain my leg extension, I would prop my ankle up and let my leg hang. Sometimes I'd even put a weight over my knee to kind of help get my legs straight. Early on in weeks 1 through 4, this is very difficult and painful. It was hard to go for more than 10 minutes at a time. But my goal was to do 10 to 20 minutes at a time and do this every hour if possible. The first 2 to 3 weeks, I was not really focused on getting this leg extension back, and that probably delayed my ability to get my range of motion back quickly. But once I started focusing on this around weeks 3, I'd say, I did get full extension back by maybe week 6 on my own without having to prop my leg up. By weeks 8, I would say, getting full extension is quite easy. It was maybe, In the morning, it's a little stiff. I have to warm it up a little bit, but within a minute, I can get full extension now at week 10. So no issues there. I do have some pain when I try to fully extend my leg. I can't go past 0 degrees straight on my own. I can hang past it, but with my own muscles, I cannot push my leg straighter. I do get some pain kind of in my knee, which it might be from meniscus tear. I'm not totally sure right now. Hopefully after my ACL surgery and meniscus repair, it's easier to get that full leg extension. We'll see on that. I can hang past 0 degrees, and if I do that and then activate my quad, there's a popping sensation that causes a lot of pain, and it just does not feel good, so I avoid doing that. I don't try to kind of cheat my way past 0 on my own with my own muscles. But yeah, now at week 10, I have great range of motion. I can go fully straight. I can bend to 120 without any pain. I can probably bend more than that now at this point, but I haven't measured it. So some tips for how to get your range of motion back besides just propping your leg up and hanging there, every hour for 10 to 20 minutes. So icing helped me out tremendously. I bought a ice pack that wraps around my knee, and I just put it on there, after exercising, after I'm on my feet for a little while walking, and this just helps reduce inflammation, which then helps me get my range of motion back a little easier. I've also bought a knee compression sleeve. This helped. I bought it around week 3 or 4. I started wearing that every day, and that helped reduce inflammation, which then got me my range of motion back a little bit better. And now diet. So throughout the last 10 weeks, I've been focusing on my diet, trying to achieve certain goals that I have. One of them mainly being my protein intake. So I've been aiming for about 0.7 to 1 gram per pound of body weight daily. So for me, I weigh around 160 right now. With that, I've been aiming for about 110 grams to 160 grams of protein per day. I haven't really been achieving 160 every day. That's kind of a high intake, but definitely hitting that low range every day at least. And to do this, I've been primarily making sure I drink protein drinks throughout the day. So just some protein powder mixed with some oat milk or water. Just make sure I get that protein in there. In addition to this protein intake, I've been focusing on some well-balanced diets. So some examples that I've been eating right now have been salmon and rice and salad or vegetables. I've been enjoying the chicken and steak bowls. So it's chicken, rice, peppers, tomatoes, onions, all that stuff in there. I've also been eating a lot of yogurt with fruit and granola added in there, or nuts. So it's a good snack throughout the day to kind of up my protein intake. I've also been eating protein waffles in the morning. So just getting some high protein waffles in. This is an easy way to get some higher protein. But currently my left leg, my strong leg, has a thickness diameter of around, 18 inches roughly. And my injured leg has gone down to 16 to 16 and a half inches. So I've lost about 1.5 inches to maybe 2 inches in diameter since I've injured my knee. So it's definitely lost muscle, and I'm trying to regain that as much as possible for my surgery. And please excuse the mess around here. Me and my wife just purchased our first house, so we just moved in last weekend. It's still a mess around here, trying to get that ready for surgery. That way everything's all set up and ready to go. But yeah, looking forward to surgery. Nervous about it. I've already gone through the 5 stages of grief, I'd say, since I had my initial ACL tear. So at this point, I'm kind of ready just to get the ball rolling, attack it head on, and get back to my daily life and get back to sports, running. I'm excited for this, and I'll see you guys next week.